I'm Lynn Westfall, and I am so excited that you are able to join us today for our 4th Women's Health Symposium, and the first to be sponsored by the Stanford Center for Health Research on Women and Sex Differences in Medicine, which we call the Wisdom Center. We are overwhelmed by the support and enthusiasm of our community. Clearly, this is a community that appreciates education. As many of you know, there will be a new hospital in a few years, and that explains some of the construction that many of you may have dodged on your way over here. And this is a great time to focus on building a healthier community. And I think that I should give Angelina Jolie a big thank you for her perfect timing in announcing that she had undergone a mastectomy for being a BRCA carrier, and also had commentary from our keynote speaker today about that. So that set the stage perfectly for some of the discussions that we're going to have today. We know that there are significant health differences in men and women, and as a physician, I see these differences every day. And these differences start very early. And as a reproductive endocrinologist, I see these things from the very beginning. So in the in vitro fertilization lab, we see that male embryos develop faster than female embryos, and that actually does change the sex differences that we see in the babies that are born. So we're going to hear from a range of wonderful speakers today that will address some of the important medical issues that affect women or affect them differently in men. And I am so fortunate to be able to work at Stanford with many of these wonderful speakers. If you miss any of the lectures today, and I know it's hard because you can't be in 3 places at one time, you can look at our website, and we're going to be uploading many of the lectures so you can watch them later, or if you want to watch them a second or third time. And since we just celebrated Mother's Day a few days ago, I would like to recognize all of our mothers, and that's why we try to have our Women's Health Forum around this time of year. And I'm lucky to have my mother here again for the 4th time. And I'd like to thank all of our mothers for everything that they do, including being the primary health advocates in most families. Thank you for making such strong choices for all of us. We could not have done today's program without the support of some very special people. And first, I'd really like to thank Roseanne Wolpert and Granite Rock for their sponsorship of this event for the 4th year. Thank you, Roseanne. And missing in our audience today is Bruce Wolpert, who was a wonderful partner for many years, and I'd like to dedicate the symposium to him today. I would like to introduce Sonu Thadani. Where is Sonu? Way in the back, waving. She's our new managing director who pulled off an amazing feat in getting today organized. We would not be here today without her hard work and determination. So thank you, Sonu. And then Tracy, Lindsay, and Marcy Palacios provided key administrative support. And I think they're around here somewhere. And we'd like to thank our interns who also have helped a lot to organize today: Hannah Benjamin, Vanessa Ochavillo, Jenny True, and Wendy Zhang. So thanks our interns. And then one other thank you to Camilla Olson. I don't know if she has made it here yet. Camilla's been a wonderful supporter over the years and designed my dress for today. And if you buy anything she's a designer, and if you buy anything, she will donate a portion of the proceeds to our program. And then just a few housekeeping issues. As you can see, we have only 5 minutes between sessions, so the lectures should be ending promptly, and we're doing that so we can stay on schedule. There is a 20-minute break at 3 o'clock, and we will have coffee and tea outside. And you can also use that time to look at Dr. Love's book. I think some of you may have seen her books on the way in, so if you want to purchase one, you can do it at that time or after we complete the symposium today. And then after the very last session, join us here at 4:45. We're going to have the Stanford Quartet do a small performance, and they're wonderful, so please come back here at 4:45. And once again, thank you all for coming today, and we hope to see you at other events. The welcome section of the program has our contact information, so if you're interested in helping to support other aspects of our center, you can find it there. And then finally, I'd like to bring up Dr. Marcia Stefanik, who will have the honor of introducing our keynote speaker today. Dr. Stefanik was involved with women's health at Stanford since its inception and was instrumental in planning today's program. Her passion is sex and gender differences in human physiology and disease, and she teaches some wonderful courses here at Stanford on that. And we've worked very closely together on developing our Wisdom Center. Marcia received her PhD at Stanford and never left, which has been a tremendous gift for Stanford. She's a professor in the medical school based in the Stanford Prevention Research Center. Her work on menopausal hormones is well known. She chaired the executive and steering committees of the Women's Health Initiative, the WHI, the largest study ever done on women in the U.S. She lectures all over the world and will be moderating some of the sessions today, and I cannot imagine a better partner in our new Wisdom Center. So welcome to my good friend and co-director, Dr. Marcia Stefanik.
Thank you, Lynn. And the feeling is mutual. It's an absolute honor to be co-director with Lynn Westphal in our brand new center. You can see we have our mission statement here. So our vision for the Stanford Center for Health Research on Women and Sex Differences in Medicine, which we're calling the Stanford Wisdom Center, is healthy women and men from conception through the life course. And we added "and men" because we realized that everything that we do with respect to sex differences is likely going to benefit both men and women. And really, women are so focused on the entire family, from the children all the way through. And so we really do believe that our mission as a women's health organization really needs to embrace men as well. And our mission is advancing human health across the lifespan through research and education in women's health, biology of sex differences, and gender medicine. And we want to talk a little bit about that. So the first thing I want you to know is that we started out as women's health at Stanford, but very early on, Dr. Westphal and I agreed that sex differences was a really important missing element in our science. And so we slowly built that up. We actually created a course. I have a course at Stanford that's called Sex and Gender Differences in Human Physiology and Disease, which is really unique. And it's a very popular course now because as we explore biology, we're realizing that much of our cell work, much of our tissue work hasn't been paying attention to the fact that XX cells and XY cells are different and how they function is differently, and it may have huge ramifications on biology. But then as soon as you start to realize that we are in a context of male roles, female roles, and very quickly those roles start to affect our biology, that the gender part of this is really important to us as well. And so gender medicine, not only does that relate to the fact that physicians treat women differently than they treat men, we look at research differently in women and men, but also the fact that we come in with different medical issues because of our gender roles. So this is our big mission. And I do want you to know that we are going to continue having the Women's Health Forum every spring. We're committed to that. We will have it around May. We'll have it in May around Mother's Day. And we also have an annual winter program, which is basic and translational research symposium on sex differences with a different theme each year. So this year we did it in March on the brain, and we really explored the female brain, the male brain, and is there in fact an intersex brain. that we should really be starting to look at what is similar about brains as opposed to different. And next year, we already have the date. It's March 5th. We're going to have an immunology symposium on sex differences, immunology and infectious diseases, which is a really fascinating area. There are a lot of differences between men and women in terms of how we get infectious diseases, in terms of immunology, and so we hope that you'll pay attention to those programs. And we'll have another one in the following winter. And then we're going to have fall programs that differ each year. And we want you to know that this year, November 14th, we're going to have a special event in honor of Iris Litt, who was actually one of the directors of the Institute of Research on Women and Gender, who really brought medicine into the gender research arena and actually funded Iris Litt fellowships so that people at the medical school can come over to the Clayman Institute and actually learn about gender and try and understand the relationship between these sociocultural factors as they affect our biology. And we're going to have the director of every Center for Research on Women, Institute of Research on Women and Gender, and the Clayman Institute on Gender Research. That's a whole series. If you didn't know it, Stanford started that in 1974. And so we're really one of the landmark places to be looking at gender, and it's been slowly evolving. And we are going to have our center, the Stanford Wisdom Center, is going to do a joint symposium with the Clayman Institute to really explore sex and gender differences, but to hear the historical record from all of the directors of the institutes and the Iris Litt Fellows. And so this is something that I think you'll find very interesting. Two last notes. We do want to have a different program every fall. We're already talking now with Michelle Berry of the Global Health Innovations Group to have a Women's Global Health Symposium in the fall of 2014. And we're talking now with Laura Carstensen, who many of you heard last year as our keynote, to have a fall program with a Center on Longevity together. So we're partnering with groups across campus who have mutual interests with ours, and we really do hope to become very successful, and we want to sustain ourselves, so this is an important issue. So we have a lot of plans. We also have funds for research. We're trying to stimulate some seed grants and research, and so this is really our big mission and vision for our new Stanford Wisdom Center. With that, we're going to move on to our program, and it's my great pleasure to introduce our keynote speaker, Dr. Susan Love, who is actually, there's a great piece about her in our program, which I also do want to thank the interns very much for putting together this great program. But there's a great piece in there that highlights the fact that she's one of the founding mothers of the breast cancer advocacy movement. And in fact, I think any of us who have been following breast cancer research have been aware of Susan Love for a very long time. She's dedicated to the eradication of breast cancer. She is the president of the Susan Love Research Foundation, which is actually launched together with the Avon Group, the Love Avon Army of Women. And if you're not aware of that, this is an online way for breast cancer survivors to basically volunteer to be part of research projects. And these women are very dedicated, very determined. They want to help all the women with breast cancer, and she probably will speak more about this. But it's very endearing when you hear her remarks about them. Dr. Love got her MD at the State University of New York in Downstate Medical Center, New York. And then she, well, actually, I don't know all the course of her path, but at some point she went to UCLA and is a clinical professor of surgery there. And she's a real inspiration to all of us. And with that, I'll just pass it on to Dr. Susan Love. Oh, and I do want to say she will sign your books if you're interested in getting her signature. We can do that in the break and then other points along the way. So if you would like to get a signed book today, you have the great opportunity. Dr. Susan Love.